Welcome back. Today, I am really looking forward to sharing this conversation with you. I'm joined with Athena, who is a family nurse practitioner, a functional medicine provider, and the president and co founder of Stat Wellness Charleston. Athena's work sits at the intersection of conventional medicine, functional diagnostics, and lifestyle based care, with a deep respect for hormones, metabolism, gut health, and the nervous system. I am so excited to have this conversation with her. I appreciate that her approach doesn't just treat symptoms as problems, but as something that we're looking at the signals for. Welcome to the Cyclical Doula podcast. I'm Emma, a certified fertility awareness educator, miscarriage doula, and the founder of Emma LLC. This space is for women who want to understand their bodies deeply. Not just memorize information, but actually feel confident in interpreting their cycles. Here, we talk about ovulation, hormones, cervical mucus, basal body temperature, and all that messy in between emotional layers that come with being a woman. We talk about trying to conceive, avoiding pregnancy without hormones, postpartum transitions, pregnancy loss, perimenopause, and everything in between. Because body literacy isn't just about charting. It's about the autonomy. It's about informed consent. It's about not outsourcing your reproductive decisions to guesswork or fear. Each week, you'll hear conversations with women's health professionals, birth workers, educators, and researchers, along with solo episodes where I teach practical skills you can apply to your own cycle right away. If you have ever felt like you should have learned this information sooner, if you have ever felt disconnected from your cycle, if you want to raise the next generation without shame around their bodies, you are in the right place. So grab your tea, open up your notes app, and let's build cycle confidence together.
Welcome to the space where cycles breathe, where the real raw life of a mama leads. From motherhood's highs to chart in the low, your body's story is the star of the show.
Thanks so much for being here, and I'm so excited to have this conversation.
Oh, thank you so much for having me. I love this.
Awesome. So before we get into what you do and all the deep stuff, tell us a little bit more about just who you are as a human being.
Yeah. Obviously I'm professionally a nurse practitioner with a background in emergency medicine and family practice and functional medicine. But outside of my day job, I am a wife to a wonderful, supportive, incredible husband. And I have three kids who are, between, early middle school, preteen age and elementary school. So I have a girl and two boys, and they keep me very, very busy, but they are delightful. And I love exercising. I have always loved exercising, and that is just something that has not. I know not everyone is like this, but for me, that is just something of like, it just feels so much of who I am, that my whole life I have been active, regardless of what season and stage of life it changes, it's evolved, but that is just something that's just so part of like stitched into who I am. So I really, really love activity. And so outside of my very demanding life, exercise has it's just mental health for me,
Yeah.
Nutrition, I love nutrition. So like outside of, that I love exercising and I love reading. So that's a little bit about me.
Awesome. Thanks so much for
Yeah.
sharing. Do you have a particular, you mentioned exercise, so I feel like this could be possibly it, but do you have a particular rhythm or ritual that you continually go back to?
That's a really good question because like I could spend an hour talking about
Yeah.
exercise has kind of like evolved over time for me. And, even beliefs that I maybe believed at one point about a style of exercise that was right or wrong and how I
hmm
feel about them now, it's like constantly evolving.
Yeah.
But I would say like my routine is pretty consistent as far as like how much time I dedicate to it. And like my like philosophy around it is like it's something that is like a non-negotiable, but also flexible. Like it has to kind of fit into my life. So like what I did a year ago before I opened my business and what I do now is not the same. Like I don't have the time to do as much as I did at that point. So now it's just got to change. So strength training has always I would say since I was in, like, early in college, I've
Yeah.
always been strength training, but it used to be more of, like, a CrossFit based, more of, like, the party tricks and the fun and da da da, like, I did strength training in that way. I actually did even rewind when I was in high school and I played sports in high school at, like, a very, like, average school, but the athletes had a class, so instead of doing PE, we did more of, like, a sports specific PE.
Yeah.
And so I started lifting weights in high school. So I was
Mm,
learning about, like, doing a clean and doing squats and bench press and all of those things. So then whenever I, like, went into, like, transitioned into CrossFit years later, it felt like a natural transition that I wasn't
yeah.
afraid of a barbell. And so I kinda went from CrossFit for, 10 years, like a long time, and then COVID happened and we were out of the gym, and then I transitioned to, just, like, weight training at home. So I've kind of always done weight training, I
Yeah.
guess. It was just kinda looked different in different stages. So I do really, really like lifting heavy weights. I'm not afraid of it.
Yeah. That's awesome. That's so cool. It's
Yeah.
something that, like, I'm hoping to get better at as I go through learning, because I think it's one of those things that, like, I didn't have like, that's not been something part of my experience, so, like, getting into that mindset is really tricky of just, like, getting into the rhythm of it specifically for me.
Yeah, yeah, and I do think that some of us are just like it's intimidating. It can be really intimidating, and what do I do if I'm at a gym? Like, what machines do I use? What's right? What's wrong? Like, if you haven't done it and you don't know how it feels, like, how do we know that this is, like, right or wrong or what? It's just a lot. It's a lot to
Yeah.
digest.
Yeah, absolutely. So what drew you into working with women's health and functional medicine specifically? Because I know that's what you do primarily.
Yeah, great question. I mean, as kind of having this, like, exercise-based background, I also have, a bachelor's degree in exercise science. I thought I wanted to go into physical therapy, and I did not. So I kinda have, like, this, like, really, like, organic way of, like I've kinda lived my
Yeah.
life in a very, like, functional movement sort of way that, as I went into, like, the conventional medicine field and believing that lifestyle was so necessary for just, like, basic quality healthcare,
Mhm.
and I learned about functional medicine at some point, kind of transitioning into my, like, nursing, degree. I found out that functional medicine was more of a root cause approach to medicine, and it just was like a duh thing, like,
Yeah.
of course, like, instead of treating medical conditions with pills as our number one resource, like, why are we not using lifestyle as our number one resource? It's so obvious. So it
Mhm.
just felt like a very natural thing for me to kinda, like, grab onto, and at that point in time, like, there wasn't many functional medicine providers, let alone training for
Right.
that sort of thing, so I didn't really even know where to start, but I just knew that it was out there, and so, I went through my, nursing program. I went into emergency medicine, which feels very contrary, but emergency medicine is so necessary,
Mhm.
and we have great high quality emergency and acute medical care, but then there's just this such a contrast because in the
Yes.
emergency department, a lot of the patients that you see are coming in for preventable issues, whether it's,
Mm.
congestive heart failure or, COPD or diabetes. Like, these are things that lifestyle can make a significant difference in improving those. And obviously there's some level that, like, we can't control, but there's
Yeah.
a lot we can. And then there's such, like, a disconnect, I think, between, like, patient education and the time that we allow for patient education,
Mhm.
and, like, how we connect the dots to them understanding that this is something you can control. So it's
Yeah.
just kinda like, I do think, like, our medical system is a little broken in that way. Kind of I was always drawn to that, like, preventable disease
Yeah.
looking at things. And then as I went into my nurse practitioner program, which was family practice, we're kind of like the gateway into medical care, and we're very much like, the quarterback, I guess you could say, of, like, this is the direction that you need to go.
Right.
So that was my foundation of, like, family practice is very broad. And then after working in family practice, I was fortunate enough to find a medicine and movement functional medicine practice in Atlanta in 2019, and that was just like a unicorn of a place. There isn't anything like Stat Wellness, and even at the time I knew that there is nothing like this practice in the world, in the country, where we're pairing movement and medicine together in a very holistic
Yeah.
way. So it was kind of like this very like cool organic thing of like one path just led to another path. It just led to another path that it wasn't ever forced. So
Yeah.
really cool.
It's so awesome. And I think like you can talk about stat as much as you want, but I think like stat wellness has like such a cool um like philosophy, like you said, like it's so niche of like being able to put that wellness aspect and that medical aspect as well as movement and like adding in nutrition and adding all of these things that just like well-rounded human being in one place and one support system is. I know there's multiple providers and professionals within that, but that it's all just like right there is so great.
Yeah, and I think that, like, even within the holistic world and the conventional medicine world, like, our medicine is so siloed where it's like you go to the GI or you go to your endocrinologist that refers you to a dietitian, but they don't ever talk, or you go to a personal trainer that doesn't understand what your doctor is recommending, like, it's just there's no communication, even if those
Hmm.
supports are maybe recommended or referred to you, it's like there's just little communication and collaboration. Finding collaboration between providers outside of their own system is like it's like impossible
Yeah.
almost. But that's why we wanted to create like a wellness home where we really do collaborate. Like I really do text my patient's dietitian and say like, "Hey, this is where I'm at. What are you seeing? And how can
Mm.
we support this patient?" And there's been times I get messages from them saying like, "Hey, I'm concerned about this. What do you think?" And it's like a very I mean, like really we are collaborating and it's just a very,
Yeah.
very cool thing. And I think it's just such a great resource to our patients.
Absolutely. So amazing.
Yeah.
So we could talk about so many different things, I feel like,
Yeah.
but let's talk about women's health
Let's
specifically
do that.
today, at least. So when you see women coming in, I feel like so many women, for a variety of reasons, are either like confused by symptoms they're having or feel like they're not listened to in traditional medical fields. So what is the like first thing that you usually notice with women?
Right, and we have to kinda look at that by age and stage, right? I
Okay,
mean,
yeah, for
types
sure.
the types of symptoms that a 20-something might experience versus a mid to late 30-something versus a 50-something, like, there's gonna be some, like,
Absolutely.
hallmark things, I think, that are most common. So, yeah, I mean, and that's even, just to put myself in the story a little bit of, like, the 20-somethings that I was, like, started having and that's another reason why I kinda, like, got into functional medicine is I started having hormonal symptoms after being like the most basic Sally when it comes to hormones for a long time. Stress was very, very high at this stage of my life.
Mhm.
2 kids fresh out of grad school, firing on all cylinders, and I started having, like, menstrual abnormalities, spotting between cycles, heart palpitations late in my cycle, anxiety I'd never experienced even having high stress, and I knew being a family nurse practitioner that if I went to an OB, a PCP, their answers would likely be birth control, and I knew that
Yes,
that wasn't an answer for me, and that's when I went another route, and not and, I'm unique. Most people, I think at that point in time, just from an education standpoint, don't know, like, "Okay, well, if that's what my doctor tells me to do, maybe that's the best I've got?"
for sure. Yeah.
We don't have any other frame of reference to
Mhm.
know. I mean, we have ChatGPT now that maybe would have changed things for, like, the general population. So I would say for somebody in their 20s, common symptoms are like acne, which it's kinda like, is that my routine? Like, it could be there's lots of reason why you can have acne that certainly can be hormonal,
Yeah.
spotting between cycles, heavy, painful cycles, short cycles, long cycles, that's probably, like, the most common things that I'll see in the 20s. Mood, oh my gosh, can we not
Yeah.
ignore mood and how our hormones are just so integrated with that, and I
Mhm.
find even in my patients in their 20s that their progesterone is low, affecting their mental health, and there is no regard for it in your 20s. Trying to conceive, obviously have some sort of issues with trying to conceive, whether it's like, you're having symptoms and having trouble conceiving, or you're not having symptoms and you're having trouble conceiving. I do
Yeah.
also think progesterone is overlooked. Once we kinda head into our 30s, I think women start having some symptoms even though their periods haven't started to change. Mood is
Mhm.
certainly one of them, body composition change despite doing it all right or no change in habits.
Yeah.
Having painful cycles after having babies is really common. And then obviously later into the 40s is when we start having brain fog, joint pain, period abnormalities.
Mm.
So it's, it kind of, it depends on what stage that they're in.
Yeah.
But gosh, I feel like something that carries through for all age and stage is mood.
Yeah.
And we really can support hormones as a way of supporting mental health that I think is
Absolutely.
just conventionally so overlooked.
So tell me what that looks like practically. Obviously, like make up a situation or a
Sure.
scenario, and not medical advice, but just general
Sure.
knowledge base.
I would say, obviously there's shades of gray here, but I think a really common thing that we'll see regardless of age is that patients are having like an increase in anxiety. And maybe it kind of comes and goes, and they're not really sure why. And maybe they notice it, maybe they don't, but it's linked to the later part of their cycle. So
Yes.
it could be the last 2 weeks of the cycle. It really could be the last week of their cycle, and then they have their period, and they feel like the fog is lifted, and they're like, "I feel so much better actually after I start my period."
Yeah.
So that's really something you can see at like any age. Like I said, because if it's connected to your progesterone levels,
Yeah.
poor sleep and insomnia can be worse around that time, which it can also result in like trouble conceiving or maintaining a pregnancy. So you might see, unfortunately, like miscarriages because checking progesterone is not something that we do in conventional medicine. Was never
No,
taught
not
about
at all.
it in
Nope.
my actual
Yeah.
training. Maybe we'll start checking it, after you've had a few miscarriages, unfortunately, but it's something that we check on if it makes sense and somebody's not on birth control, if they're, eh, wide
Cycling
open,
on their own. Yeah.
we'll check it on every patient.
Yeah.
Yeah.
And do you check it multiple times throughout what somebody thinks their cycle is?
Really good question. I try to find the sweet spot between convenience and data, right? Like, of
Yeah.
course, if in a perfect world, we would get labs drawn during your like kind of follicular like day, 3, 4, 5. Like we would do that and luteal. I do mid luteal, but for the sake of convenience for my patients, I really do mostly do mid luteal.
Yeah. Yeah. That's super cool. I think one of the things that because the work that I do is so focused on cycle tracking, I always remind patients that or clients that I work with, like when you go as a patient to see somebody and they say mid luteal, make sure you know when ovulation has taken place so that
Exactly.
it's actually your mid luteal and not just some random time in your cycle, which,
Right, and that, and it's trying to find like there's some patients that are so detailed that they
yeah,
know all of those things, and
for
then there's
sure.
other people who don't, so we're kinda guessing a little bit,
Absolutely.
based on their symptoms. I will sometimes say, "Hey, based on what I'm seeing here, I think we should actually do day 16 or day
Hmm.
20." So we'll
Yeah,
kind of like our range is 18 to 22 for like a
for sure.
28 to 30-day cycle, but 100%. And we'll have to, I mean, with that, based on, on some patients that end up on maybe a progesterone replacement or some sort of thing like that. Like we don't want to start progesterone too soon before
Yes.
ovulation. So sometimes we really do need to know, like, hey, you need to wait until when
Yeah.
you ovulate to take progesterone.
Yeah.
So it's a really
Absolutely.
great point.
Yeah, so that's so cool. And you mentioned, and I am wondering this as a knowledge base, if you know, so when people are experiencing anxiety, you said like sometimes people are experiencing it for like those 2 weeks of the luteal phase, and sometimes it's just one-ish. Do you feel like it's because of like there's for some people like they have weak progesterone for like or lower progesterone for that whole luteal phase, or some people have it for like their progesterone's fine and then it like drops significantly? Like, is that something that you see or do you know?
Right, and because the way we generally function, we're not necessarily checking like a
Yeah, that's true. You're not checking
right,
like
so, like,
daily. Yeah.
I love them, but that's probably not something I'm necessarily gonna ask my patients to do, but it depends on the patient because sometimes they're interested in it, and I'm like,
Yeah.
"Great, let's do that." If you wanna do
Yeah.
urine tests every single day and you're checking your estrogen, your progesterone, your luteal hormones, all of those things, what are they, like, Mira? Like, there's a few
Yeah.
products
Mirror's
that check
probably
those.
the one that's the most
Love
accurate
that.
right now. Yeah.
I do think that there is it's both and, right? Like, I do think some patients feel like it's kinda weak the whole time, or it's that last 2 days of the cycle that we just take a nosedive in our
Yeah. Yeah.
hormones, and, um, I would say, like, for perimenopause symptoms, like, you might check their labs and they kind of look picture perfect, and I'll
Yeah.
tell them, "Hey, let's hold this open-handed," um, because they will notice a nosedive, and their symptoms would maybe suggest low estrogen, like night sweats, but only during when they start their period, when the estrogen gets really low,
Oh, interesting.
So, I do think that it's both and.
Yeah.
I think symptoms are more concentrated to the last week, but if we really wanna support progesterone in, like, maintaining some stability, then
Mhm.
at, like, 2 weeks, I think can be helpful, but they're flexible.
Yeah, absolutely. So obviously, like, there's progesterone supplements out there that are helping people so much, but do you do more research into like why somebody's not producing progesterone really well?
Yeah, that's a good question. I mean, obviously being a root cause approach, to medicine, we kind of take a both and approach. I like to try and do both where I'm doing, like, short term, long term,
Right, for
where I'm
sure.
like, "I want you to feel better
Like,
ASAP."
let's function for right
Right.
now and and also, yeah.
Right, and it kinda depends on their capacity of, like, how were they ready for this to be, like, fixed, like, yesterday, or do they have a little bit of bandwidth of, like, "Yeah, this isn't great, but, like, we have some time to, like, really work on root cause," and so it kinda depends on, like, are we doing short term, long term at the same time?
Mhm.
So, I do really think that adrenal/stress make have a big impact on our brain's perception of threat.
Yes.
And because we know that our HPA axis, our hypothalamus pituitary adrenal axis affects our gonads, our sex hormones, that pathway matters,
Mhm.
whether we like it or not. And so I do think like the stress that we experience, but it doesn't necessarily have to be emotional stress. It
Yes.
could be physical stress,
Right.
meaning what about an autoimmune disease that is threatening the safety of our body?
Yeah.
What about the gut infection that we've been experiencing? What about, like there you can kind of come up with a lot of physical issues that also
Yeah.
cause our brain to perceive stress. So I do think
Mhm.
autoimmune patients are a great example of like how they can have trouble conceiving because there is this like brain body connection happening. So
Yeah.
I do think like adrenals matter. Sometimes it's like activities to support that
Mhm.
perception. Sometimes we use, supplements like ashwagandha and rhodiola and all of those things. So anyway,
Yeah.
there's like stress adrenal piece. I do think autoimmune matters as a root cause. I do think gut support matters, inflammation, blood sugar. Like, so yeah, it really does
Yeah.
come back to like that person and the why. Like how are all of the symptoms lining up or their medical history lining up to say like what's going on under
Mhm.
the
Right, right, right. Yeah, because 'cause I'm sure you can see more than just that, like, one thing that's there as you
Right,
talk
yeah.
to somebody and get to know them and yeah.
Yeah, there's probably something else going on, and that's
Yeah.
why we take an hour for our new patient visits to get their medical dialogue. We say our timeline where like, a timeline really, really matters. So if you go back to, like, birth, or puberty, or what happened in your early 20s, 30s, 40s, like, you can really understand a lot about how a person's body functions if you really go back
Yeah.
in time, which obviously we don't have time for in our 15-minute appointment,
Yeah.
you know? So yeah, I think that that's all kind of part of like painting the picture.
Yeah, I can imagine that's so helpful because as somebody goes through all of those, like, life circumstances, they might be like, "Oh, like, that one thing that happened when I was a teenager might be also influencing all of these other things,"
Yes,
that could be a factor of all of the other experiences that you're having with these symptoms and stuff like that.
totally. I think that's something that can be overlooked, that we can pull out during, pull out during a new patient visit is like trauma. I do think that there's a lot that we don't know about how our bodies respond after traumatic experiences. And
Mhm.
I do think that at STAT we do see patients that are just having trouble with breakthrough. That it's like, okay, well, we've done everything. We've done all the stool
Yeah.
testing. We've done everything you could possibly imagine, and until we can kind of pull some like trauma processing out, it's like the body keeps the score. So
Yeah.
that's a root cause thing that you're not gonna see in conventional
Right.
practice.
Yeah.
Yeah.
Amazing. So you also mentioned that progesterone not being produced well or being low can cause problems with trying to conceive and miscarriages and all of those things. So that's obviously like one aspect to that. But what else do you like to work with and look into when somebody is trying to conceive and just like wants to like be the best version of themselves going into it?
Yeah, the other side of the progesterone coin is estrogen, like
Yeah.
having not too much and not too little
Yeah.
estrogen. And so we're definitely looking at that. And there's kind of symptoms associated with both. Like sometimes you can kind of tell without even looking at labs, like, oh, I bet that they have high estrogen or I bet that they have low estrogen. And progesterone and estrogen, like they work so like synergistically together. So that's why
Hmm.
I think progesterone is like an ignored hormone, generally speaking, but we
Yeah.
want to make sure that we don't have too much or too little estrogen. So we're definitely looking at that and ways to support that. Adrenal support obviously is baseline. I like to look at AMHs depending on the patient. I think that's a very proactive thing to do because there are things that we can do to help support ovarian. AMH is connected to ovarian health. Same thing, not too much or too little. High
Hmm.
AMH is typically associated with things like PCOS.
Yeah.
Polycystic ovarian syndrome, which has, implications for conception and fertility. And then too low is also a problem. We're thinking like diminished ovarian reserve, where it's like maybe
Right.
you don't have, do you have enough eggs to
Yeah.
make babies? Which even that marker is imperfect. I've seen patients
Hmm.
that go and have egg retrievals for their own, egg freezing and things like that. And they had a
Yeah.
low AMH and they're worried about their conception. And then they have a great production if you
Yeah.
look. It's an imperfect marker, but I do use it as, like, a piece of information.
Yeah.
You get, FSH and LH depending on the patient, that can kinda tell me how well the brain is communicating with the ovaries. Thyroid function is super important. We really hold a tight window for thyroid function,
Hmm.
when we're talking about conception and hormones kind of in general.
Yeah.
Especially for fertility, I would say for other reasons, it's important, but kind of indirectly related.
Yeah.
Um, Inflammation. We look at
Mm.
CRPs, that's kind of related to everything. Blood sugar, we gotta, I've talked about a few.
Yeah, it's all yeah, all
So
connected.
connected. We're one body, and all of our systems communicate, so they really do influence one another.
Yeah, and I think it's important to acknowledge the fact that, like, if you're trying to be, like, the most healthy version of yourself, like, that it doesn't matter what your reproductive intentions are in that season, the same things apply for sure.
Exactly. I always talk to my patients about like it's helpful for me to know whether you are or aren't going, trying to conceive or planning to conceive. However, increasing your reproductive health is increasing your fertility. Like they've just
Yeah.
been the same, but
Mhm.
sometimes we might adjust like how aggressive we are based on your goals.
Right,
Like,
right, right.
sometimes we'll do lifestyle based things first instead of
Yeah.
doing a pharmaceutical, for instance. So
Yeah. So I feel like so often in the like trying to conceive world, there's all of these supplements out there that like they're like, you should take this and you should take this and you should do this. What like really should somebody do other than like going through their like specific needs of what they need for their body specifically?
yeah, like if you haven't had your labs drawn and you don't have a frame of reference of like what's going on
Yeah.
under the hood. I mean, lifestyle first always, right? Like if we're
Mhm.
generally every single one of us taking care of, I really say it's five, maybe six. We can say the sixth is like somewhat like, optional, but five basics are how
Okay.
are we sleeping? We need to sleep. We need
Yep.
to rest and digest, right? Like we need to be like recovering every night. So generally
And what
speaking,
does that look like?
what do you mean?
Like
Like
how long? Yeah.
Oh, I mean, I really do think like 7 to 8 hours. I
Yeah.
mean, 8 in a perfect world of restful sleep, right? Like, not
Yes.
just
Yes.
sleeping, but
Yes.
like
Yes.
restful sleep.
Yeah.
There's so much you could talk about in like optimizing your rhythm and deep and light and all of
Mhm.
those things. But, sleep and sleep quality. Stress management, we can only do so much of that, but there's some things we can
Yep.
control. Relationships, we really need to feel safe and supported
Mm.
by the people around us. So they're like
Yeah.
those are really important. And then the obvious things like how we eat. You know, everybody's a little different, but I really like to say whole foods. Like there's not a lot of question about the benefit of eating whole foods, meaning like
Mhm.
chicken is chicken, broccoli is broccoli, and then we don't have to worry about like, is it a chemical? Is it not a chemical? Like as whole food based as possible, and then
Yes.
it makes it very clear. And then, not too much or too little. We don't want people undereating. We don't want overeating. Like both of those things matter. Um, and then preferably like movement that you like is the
Yeah.
preference. So like we don't want you to like dread and hate the type of exercise that you're doing because some
Mm, mhm.
you that it's what you should be doing. We want you to do it because it brings you joy and helps
Yeah.
like ease, stress and all of those things. So we want you to move. So those are the basics. And then the sixth one is we have to kind of talk about our environment is
Mm,
toxins, whether we
yes.
like it or not, the air that we breathe, the water that we drink, the food that we put in our body, like it it is becoming more and more toxic.
Yeah.
So I do think that like the microplastics and the hyper processed and the chemicals, like they are taking a toll to some degree. So that's kind of like number 6 that like, everybody's going to be a little bit different on how extreme they want to take it because we can't die on every hill. So that's why I say the 5 things are the most important and the
Mhm.
6 are like if you want to take it a step farther, that one's going to be pretty beneficial for all of us. Like it can't hurt
Yeah. Yeah.
to carry the
Absolutely.
toxin.
For sure.
So I do think that those are the basics for everyone because I think if we're feeling like whole and safe and we're doing kind of the best we can in all of those departments and hopefully our body is really functioning optimally,
Mhm.
right? And so that's like probably the basics and then like as far as like supplements go, it really should be like supplementing, right? Like if you're
Yeah.
eating a
Yeah.
food-based colorful diet, you really shouldn't need a ton of vitamins and nutrients, although
Mm.
we're a lot of us don't get enough vitamin D. I check vitamin D on every single patient, and generally speaking, all of us are deficient. So I do think we need more because we stay inside more. We're animals that have become indoor cats.
Yes.
So we just need enough vitamin D by being outside. So I do think a lot of us need more vitamin D. I do think based on our diet, we don't get enough like healthy plant-based fats or omega-3s, whether it's plant-based or not. So I do think
Yeah.
a lot of people do end up needing a bit more omegas in their diet.
Yeah.
I do see that a lot of patients need B vitamins. So I
Mhm.
do end up supplementing based on labs. So you can't go wrong with like vitamin D and a multivitamin and a fish oil. Like that's a
Yeah.
pretty basic thing that most of us can benefit from without like having labs checked.
Yeah. Yeah. That's great. I think like those 6 things that you mentioned, like that's really important for us to work on all of those all the time. And it's so, so good. I ironically you were talking about eating whole foods and talking about chemicals in your foods. And my daughter on her way back home today from our appointment, we've been talking about like the difference between meat products and stuff. And she was eating a protein bar and she goes, is this have animals in it? And I was like, no, like that one's plants and she was like, "Oh, interesting." And I was like, "Well, foods can come from like plants or like other materials or animals." And then I was like, "And there's some foods that are made from chemicals." And she goes, we're not supposed to eat chemicals." And I was like, "I know." But it's one of those things, right? That it's just like eating whole foods is better in general. And I am not 100% on that all the time, but it just is a funny thought process.
Exactly right. Yeah,
Yeah.
and they're such black and white thinkers that they're like, "Wait,
Yeah.
how
Yeah,
does"
and she's 4, so she's like she has no idea. But I was like, "I need to figure out how to explain this to you better, but yes, you are mostly right."
right? That's so
Uh,
fun.
yeah. So when, you're working with people, I what is the thing that you, like, feel comes up for the most as people start working with you in regards to feeling supported?
Hmm. The what they need the most support on, you mean?
Yeah, or like how they feel. I guess my question was more of like how they feel better after working with you. Like, what is their outcome feeling good about?
Yeah, I think that more often than not, and you probably experience this a lot with your patients, is they
Yeah,
maybe like didn't know, right? Like there's
yeah,
just so
yeah.
much things that they didn't know that once they kind of bring awareness to like, oh wow, I just like didn't realize, that it would should kind of look like this or look like that.
Hmm.
That they feel more in tune with their body, they feel more comfortable in advocating for themselves and coming up with like more creative ideas on, like, how they kinda feel about taking care of themselves, and I think they feel more empowered. So that's probably the main 2 things is they understand themselves more and they feel more empowered to make, like, really strong decisions for themselves, and, I mean, that's probably the thing that I'm the most passionate about And it kind of comes up in women's health a lot because I think historically we've just been neglected so much in
Yeah.
the conventional world that like that ends up being such a place of like feeling empowered that like, no, I don't really have to do, what I'm told, but I can use this professional as one of my sources of information. And I get to
Mhm.
decide, and I really encourage my patients across the board, like, hey, listen, I am one person with one perspective. Like I do encourage you to go to your OB and ask these same questions. And here I will arm you with the information that I'm giving you in a way that you can tell them, well, hey, this is what my other provider said. Like, what do you think about that? Like,
Mhm.
what do you, I think, like, even progesterone is a great example because, like, I love it so much. I'm
Yeah.
not for the purposes of prescription, but like just supporting it across the
Understanding it. Yeah, yeah.
it's like, well, hey, if we talk to your provider about like this is why I want to support my progesterone and what do you think?
Right.
Like I just like to arm my patients with as much information as they can so they can feel empowered to like make their own choices
Absolutely.
in any regard, whether it's
Absolutely.
health, gut health, hormones, mental health, whatever it is. Like I
Mhm.
just want them to be able to lay out all the choices and decide what's best for them.
Mhm.
And I think like hormones are just like a great example of that.
Yeah.
Yeah.
Yeah. Amazing. Hey, all. I absolutely loved my conversation with Athena. Unfortunately, the last few minutes of it didn't upload properly, and so we lost that part of the recording. But to generally sum up, Athena was sharing a little bit more about her specific practice at Stat Wellness and how to find her. So you could find her. I'll put all of the links in the show notes, but you can find her on Instagram at Athena Newell FNP, and her website is athenanewell.com. But I so appreciated her sharing all of those things. You can also find her on Stat Wellness's website, which I will also link. And if you're in places other than the Charleston area, you can find Stat Wellness. Other locations through their website as well, and scheduling a 15-minute call with Athena can be a great way to get information about if their practice would be right for you and the support that you need. So thanks so much for being here. Thank you for listening to this episode, and I hope you found some great insight in it. And I really appreciate Athena being on it. Thanks so much for being here today on the Cyclical Doula podcast. If this episode resonated with you, the most powerful thing that you can do is to share it. Send it to a friend, text it to your sister, forward it to that group chat. This is how conversations about our bodies start changing. Quietly, organically, woman to woman. If you are listening and thinking, okay, I want help applying this to my cycle, I offer free cycle clarity calls. It's a relaxed conversation over Zoom where we talk through your goals, your charting practices, and what kind of support that would actually make sense for you. You can book one at emma.com/free. And if you haven't already, make sure you're following or subscribe to the Cyclical Doula podcast so that you don't miss future episodes. And if you feel called to leave a rating or a review, it genuinely helps more women find this work. So thank you. You deserve to understand your body. You deserve to feel confident in your reproductive choices. And you don't have to figure it out alone. I'll see you next week. Thanks for being here.
Welcome to the space where cycles breathe, where the real raw life of a mama leads. From motherhood's highs to charting the low, your body's story is the